So today we're going to talk about some of the most common shoulder injuries that we see in baseball players and some of the different tips that you can employ to make sure that those injuries don't get worse. The first common diagnosis that we see in baseball players is rotator cuff injuries and shoulder impingement. So on this model, I'm going to kind of show you where the rotator cuff is and what it does. So the rotator cuff makes up 4 muscles within the shoulder. The job of the cuff is to keep this shoulder real tight inside the socket so that it doesn't move too much. Excessive movement causes shoulder impingement. So as you can see here, we have all these bones around there, and there isn't a lot of space for those tendons to move near those bones. So what can happen is this friction can create irritation at the tendon, and sometimes if that friction is bad enough and an athlete throws too much or they're under too much fatigue, they can get a tendinitis, and that tendinitis, if not managed appropriately, can turn into a partial tear or even a full thickness tear. Now, we do have some information that says in MLB players, they took a whole bunch of them that are throwing athletes, in baseball, pitchers, outfielders. They put them through MRI machines, and they took a look at these tendons to see, do they have tears in them even though they don't have pain? And what they kind of found out was all these people, all these players had tears in their rotator cuff, but not all these players had pain. So you can have a partial thickness tear and there be no pain at all. Now with full thickness tears, typically if that tendon here is completely torn, then it will need surgically repaired. They'll go in, they'll put some anchors, and they'll suture that back together to try to normalize the shoulder motion as best as possible, and then you're doing rehab after. But for partial thickness tears, physical therapy is a great management tool, and you can get rid of the pain and get back to throwing as much as you want. The second most common diagnosis we see is labral tears. There's many different types of labral tears, so we're going to talk about the most common one. It's called a slap tear. So what a slap tear is where the bicep tendon gets irritated and it starts to peel off of the top portion of the labrum. That peeling sensation creates a deep shoulder pain and then also, like I said, irritation right in the groove of the shoulder. Most common in throwing athletes, so your baseball players in the outfield, infielders, and then also your pitchers. It's really important that this gets identified quickly because it can worsen and worsen and worsen, and if enough of that peeling happens, then the patient may actually need surgical repair to tighten up that labrum. The role of the labrum is to keep that shoulder joint nice and tight, just like the rotator cuff. So if either of those two structures are compromised, you're going to end up in pain and that shoulder isn't going to move the way that it should. So 2 tips that you can do to help prevent some of these shoulder issues from either becoming a problem or to get them to chill out if they are giving you pain. Tip number 1 is you can avoid stretching into internal rotation. So one common misconception is that baseball players will say, oh, I'm super limited here. This is real stiff, so I need to stretch that. That's not true. The goal of baseball is to be able to get enough rotation for your arm to get back here so that you can build up power and momentum to throw the ball and propel it through the air. Now, if you can't get far enough back, then you're going to lose power, you're going to lose performance. When you stretch in this direction, you are then, instead of having this full range of motion here, you're reducing that range of motion. So you're actually predisposing yourself to more injury. The worst thing you could do for a throwing athlete is to stretch them into internal rotation, even if you think it's super stiff. So tip number 1, don't do that. Tip number 2 is managing pitch count or throw count. Oftentimes, these athletes, especially with like club ball, if you're more in the high school side or in the grade school side, if you're playing club sports, you're throwing constantly all year round. You're not giving your arm a break. So you're more so predisposing yourself to labral injuries and tendinitis. So it's actually super important that you're monitoring your throw count. If your coaches aren't, you need to be. Parents, you need to be monitoring throw count too. There's generally accepted guidelines that are put out by the pediatric associations that say you should not throw more than this many times per practice and then also per week. So recommend you looking that up or asking your club for that information because they should have guidelines around that to help save your kids' shoulders.